Welcome to MCQs for All. Most trusted MCQs, 5-star rating, most economical in market, plenty of success stories and quality updated MCQs by experts. Medical MCQs for All is a very high-yield material which is prepared to get best results from various exams such as DHA, MOH, HAAD, DHCC, OMSB, SMLE, QCHP, NHRA, KMLE for GP doctors and family physicians. Also helpful for other exams like PLAB, USMLE, AMC and NEET PG aspirants. It includes practical scenarios in daily medical practice, past papers and mock tests very similar to that in real exam. Our services. Meet our experts. Here is our team. Contact information. Let's begin with the topic. Cardiology. Cardiology is a branch of medicine that deals with the disorders of the heart as well as some parts of the circulatory system. Let's begin with the MCQs. Question 1. Patient has sudden right eye pain, red with dilated pupil, cloudy cornea and increased intraocular pressure. Left eye by examination has cupping disc and normal intraocular pressure. Which of the following is the likely diagnosis? Options are A. Right glaucoma, left glaucoma. B. Right uveitis and left retinal degeneration disease. C. Right conjunctivitis and left reflex symptoms. D. None of the above. Here is the explanation. The correct answer is A. Right eye is glaucoma eye and left eye cupping, and atrophy of optic nerve, mean there is glaucoma even intraocular pressure is normal, which mean is chronic glaucoma in left eyes. Glaucoma is one of the most important causes of blindness worldwide. It's characterized by increased intraocular pressure, damage to the optic nerve, and irreversible vision loss. The pathogenesis is not fully understood. Ischemia may play a major role in leading to atrophy of the optic disc. Question 2. A 17-year-old boy suffered a generalized seizure at school, and is brought to accident and emergency room by ambulance. His teacher reports, he was well during the day but has suffered from repetitive ear infections, and despite taking antibiotics during the week, still suffered from headaches and ear discharge. On examination, he appears well, but complains of headache. His temperature is 39 degrees Celsius, and he is neurologically intact. A CT scan confirms a cerebral abscess, and rapid culture tests confirm streptococcal infection. The most appropriate management is? Options are A. Cefuroxime alone. B. Cefuroxime and metronidazole. C. Flucloxacillin alone. D. Flucloxacillin and cefuroxime. E. Surgical decompression. Here is the explanation. The correct answer is B. A cerebral abscess is one of the most dangerous complications that can result from infections affecting the face, and any of the routes that allow infection into the brain, such as sinusitis and otitis media. Patients can complain of fever, headaches and seizures among other presentations. In stable patients, pharmacological therapy is dependent on the suspected organism. For streptococcal and anaerobic infections, intravenous cefuroxime and metronidazole are required. Staphylococcal infections require intravenous flucloxacillin with cefuroxime D. In general, staphylococcal infections are more common in abscesses. Cefuroxime A and flucloxacillin C alone are not adequate treatments. Surgical decompression E is required in patients who are unstable or have remained refractory to antibiotic therapy. Question 3. A 55-year-old woman presented with truncal obesity, easy bruising, a dorsal fat pad and depression. She denies any headaches, weight loss or any other abnormalities. An ultrasound scan showed bilateral adrenal atrophy. What is the most likely cause? Options are A. Exogenous steroid use. B. Pituitary-dependent Cushing's disease. C. Ectopic adrenocorticotropic hormone, ACTH, production. D. Adrenal malignancy. E. 21-hydroxylase deficiency. Here is the explanation. The correct answer is A. An exogenous steroid use causes a negative feedback response, whereby pituitary, ACTH, production is halted. Adrenal stimulation also stops, causing bilateral atrophy. Let's understand the other options' meaning. In option B, in pituitary-dependent Cushing's disease means ACTH is produced in excess, which would cause bilateral adrenal hypertrophy. In option C, an ectopic malignancy producing ACTH would similarly cause adrenal hypertrophy. In option D, an adrenal malignancy means such as an adenoma in one adrenal gland would suppress ACTH production, causing atrophy in the normal adrenal gland, while the adrenal malignancy would remain normal or hypertrophied from malignant growth. In E, 21-hydroxylase deficiency would cause an increase in ACTH production from the pituitary, also causing adrenal hyperplasia. Thank you.